This is Charles Patton sitting in for your sister Ya for the Tacts Association of Clinical Trial Services. And we are here to talk about health equities. As we've been doing for the last few months, trying to make sure that we can get the word out about making sure that we are being equally treated and getting what we need. Not just to be servicing people on a blanket level, everybody getting the same treatment, but just talking about the things that we need as individuals, because everybody doesn't need the same thing. And we want to make sure, as particularly as being people of color, that we can get the services that we need so that we can stay healthy and continue to thrive in a troubling economy. We know that right now the issue with insurance and some of the other problems that we are facing in the community is making people extremely sick. And we want to make sure that we can get them the information they need so that they can access the services. Now, we know that we have been working, granted that our legislators appear to be working, but we know that we don't have a state budget. We know that a lot of the programs that we are seeking is either cutting services or closing their doors. So I, as being the people's counselor, the PC, if you will, trying to make sure that I can advocate for my clients and make sure that we can get them the best information possible. So once again, this is Charles Patton, sitting in for Sister Ya for the Association of Clinical Trial Services, and we are talking about health equities. Now, Tacts. If you want to reach us, you can call 312-961-6189. And also, we want to talk about trying to eliminate some of the disparities that we've been experiencing in certain areas within the city, actually throughout the nation. We know that violence is a major issue, and it stems not from the lack of access to treatment, but it also stems from some of the poverty that we experience in our community. And I'd be remiss if I didn't mention the mental health aspect. As I stated, I am a substance abuse counselor by trade, the people's counselor. And mental illness is one of those conditions that most people do not like to talk about. But we know that we need to address it because it is affecting our members of our community, whether it's our nieces, nephews, sons, daughters. If you've been paying attention to any of the news shows lately, there's been some horrific events taking place that can only be attributed to poverty, the lack of good counseling, and of course some of the mental illness that's not being diagnosed, if you will. So we need to start to do what I like to call some integrative work. So we need to really start talking about accessing insurance. We know that the Affordable Care Act has been a very big thing, and of course we're in an administration now that's talking about repealing and replacing. So we need to start advocating to make sure that everybody can stay covered. Then we also need to try to talk about how to collaborate with other agencies so that we can get services, or at least have people to access services that we don't necessarily provide. I know personally I work with several housing agencies because we got a lot of homeless youth. We have a lot of homeless elderly people. And of course, those particular factors also factor into the lack of nutrition, the lack of just overall well-being. Because when you don't have your basic needs met, then that adds a whole different level of stress for people. So once again, let me show you one of the slides that we deal with. Let's see. Okay, we seem to be having a little difficulty with these slides. But at any rate, I want to talk to you about diversity. And with diversity, we know that we have to increase our involvement in getting information about clinical trial. Because that's another aspect of health equities. To make sure that the medications, the information, the services that we get in are geared toward us, that will provide us with the best outcomes. Okay? So we definitely want to do diversity. The next thing we want to talk about is the health equity paradigm. And basically what that means is that we look for policy change. We are looking for community capacity building. And we also are looking for some of the institutional changes, because we know that the prison industry complex has been a scourge for certain populations. We know that some of the policies that are in place are not yielding the best outcomes. We know that some of these insurances that people do have access to are minimizing the coverage that they can receive, and of course limiting care, which put people at greater risk. Okay? So truly we want to start talking about how we can use Tacts to access those services. All right, so here we go. This is what we call our health equity paradigm. Okay? And with that being said, we're going to transition out for Sister Ya.
Well, sure. So the one thing we want to make sure is that we have diversity in clinical trials research. So making sure that this is a part of what we put on is clinical trials, and having that part of our research with diversity means that we have a lot of people who should participate in clinical trial services. I just wanted to let you all know that I have a cold. and I have been trying to get through this cold. So Tacts, the Association of Clinical Trial Services. I am your community epidemiologist, Sister Ya. And if you'd like to call in at 312-738-1068, please do. That was Mr. Charles Patton. I'm sure he told you that he is the people's counselor, right? And what we're trying to do on this show today is just really go through one of the events that happened past last week or so. So this is February. We all know that, right? And on February 7th was National Black HIV/AIDS Awareness Day. I'm not sure if you knew about that, but excuse me. That's a day that's nationally observed, and we observed it here in the city of Chicago as well. So I want you to know that we definitely made a focus about at the what they're calling now the AIDS Art in America programming. This is the Beauty, Sex, Loss, Courage, Politics, Arts, AIDS in America. So what is that really? Arts, AIDS in America was where we were at 2401 North Houston, and we talked about race and HIV. Yes, we did. And as we talked about race and HIV, one of the things that I wanted to make sure that we did, because like I mentioned before, National Black HIV Awareness Day, right? That was February 7th. So I wanted to make sure, as I was one of the panelists, that we talked about where blacks are. And more specifically, what I was able to do was talk about where blacks are in Chicago. So again, I apologize for coughing so much. But Just so you know, in 2015, if you could probably see a little bit here, in Chicago, there were 35,000, almost 36,000 people living with HIV. But of those, you have to know that 51% or 18,000 people, black people, are living with HIV infection in the city of Chicago. 18,332 people are living with HIV infection in the city of Chicago. These are very specific numbers right here to the city of Chicago. And one of the things I want you to take away is that when you look at this particular data, if you can see it, I know it's a lot of words, but what I want you to know is that the number of cases are going down for black people, but black people still, even with the number of new cases over the past 5 years, they have gone down. But we still, even with the number of new cases, represent more than half. Blacks also account, and if you can see that, for 806 of those who are duly diagnosed. Now, what do I mean by duly diagnosed? I mean that they have HIV plus syphilis, HIV plus gonorrhea, HIV plus chlamydia. One of those three. And you have to ask yourself, if you're HIV positive, how come you have a dual sexually transmitted infection? Excuse me. And the reason being is because all three of those, including HIV being 4 now, right? 4 of those are transmitted all the same way. Unprotected sex. Now, injection drug use is also something we should be concerned. I mean, it's always going to be a concern for us to make sure that people have access to what we're calling clean needles, right? We want to reduce the behavior, but we also are clear it's blood-to-blood contact that is transmitted where you have HIV from one person to another. Vaginal fluids and semen fluids are also what's transmitted from one person to another. So that's either sex or injection drug use. We have to deal with that because comorbidity is a real factor here. As you can see, if you can, we had at least 38,000 total STIs reported in the city of Chicago. I said 38,000, and about 18,889, 649% were black. So we're dealing with comorbidities that we can actually prevent. We can prevent these cases from happening, but they're not being prevented. Even though we have the tools and mechanisms to do so, there is one thing that I have to focus on no matter what happens, is black people got to get out of this whole conundrum of not getting care, not seeking the most up-to-date care, and more importantly, not taking the initiative to do what is best for us as a whole, which means you need to become virally suppressed. And who is you? The people that I just mentioned living with HIV infection. The only way it can be spread is if the people that are positive spread it to a person that is not, I don't like the term positive. If a person who is infected spreads it to an uninfected person. Let's be clear, that is the only way. But just like they got it, you can get it too. The idea here is that people who are HIV positive play a role in how we prevent HIV. The role that they can play is becoming virally suppressed. So let me talk to you a little bit about what virally suppressed is. I'm not going to read all the data at the bottom, but just be clear. Of the 122 black women that were newly diagnosed, that's 85% among women, only 44% of the black women were virally suppressed. Of the 608 black men, only 6 who were newly diagnosed, only 48% of them were virally suppressed. Basically, black women are the only group that is the least virally suppressed. Come on, ladies. So why is it that black women are not virally suppressed? What is going on that they cannot get the medication that it takes to keep the virus from replicating? And that is what virally suppressed means. We have to keep that virus, the human immunodeficiency virus, from replicating in the body. And we can do that, or it can be done, through treatment and care. Now, I admit to you, the treatments are not the best of everything. Nobody wants to take a whole bunch of medications. But guess what? They are simplifying it. Nowadays, you can take a treatment plan that is down to 2, maybe even only 1 pill a day, depending on where you are in the, as we call, continuum of your virus. We don't want you to progress to AIDS. We don't want you to progress from AIDS to death. And unfortunately, I did get a call yesterday of someone who actually has progressed to that. Because you know why? He didn't tell his family he was HIV positive. Now he has AIDS and he has only 25 T-cell counts, which means that he's wasting away. He's dying, and he has a young daughter who's pregnant, and they have no other family members. And I'm getting this call as in to what to do. I don't know what to do now because all the prevention work, all we can do is say quality of life. We don't know if he's going to live tomorrow or 2 years from now. But right now, he's not doing so well. And there's no reason that he couldn't have gotten any treatment before now because he actually had Social Security and he could have had health insurance. What are we doing, people? I need you all to start reaching out to your family members and stop all this shenanigans about, I don't want to know if he's HIV positive. If it's your family, you're going to need to know. This man has cousins. This man has brothers and sisters, and none of them came to his aid. Now he's in the hospital right today. I got this call yesterday. He's in the hospital with a T-cell count of 25 for no reason. Because the physicians were like, had he just come in earlier, we could have did something to help him. So that was my tangent. I know I went on that a little bit strong, but I need you all to recognize we're not just here talking. We're trying to save people's lives. If you're interested in having more information around health equity topics such as HIV infection data, hey, holla at your girl, this Sister Ya, because I want you to be able to get this information. I will email it to you free of charge. That is what Tacts does, the Association of Clinical Trial Services. We do bring science to the people. That's one of the things that we want to make sure we do. And as you heard from Mr. Charles Patton, who is our people's counselor, we also work with people who might be formerly incarcerated, as well as veterans, as well as those who want to get HIV or hepatitis C tested. We will make sure that you get that. Those are some of the things that the people that I work with provide. I also want to give a shout out to the National Black Agenda Consortium. This is one of our new initiatives that I've helped to write, which is the Health Equity Equal Black Unity Emoja Healthcare Campaign. I really hope that you all take into this because this Health Equity Equal Black Unity, oh, that's going to be a strong campaign. Guess what we're trying to do? Oh, no, I'm sorry. Guess what we're going to do, callers and listeners? We're going to change how we look at healthcare, how we measure ourselves. We are no longer going to measure ourselves to the dominant culture because we're always dismayed, dissatisfied, disproportionate, and I'm tired of being dissed. So we're going to find a way for us to uplift ourselves and to move forward on how we look at healthcare. If you got an idea about how to do measurements around looking at the best possible health a person can have, which is health equity, among that group, that means you benchmark from where they're at, and then you go from year to year, 5, 10, 15 years, to see how best they can move along. But let me be clear, a homogeneous society definitely does better in healthcare. We may not get that living in this country, but we can get that among ourselves. We can't, there's nothing stopping us from being homogeneous, and we can do it. So, a little bit of coughing there, but I know we can do this. But one of the things that I want to make sure is that you go to their website and you look up the agenda, because I'm only speaking in health and wellness, but of course there's obviously more to it than just that. They have a plethora of different topics, including reparations. They're dealing with topics of police brutality. They're dealing with topics of education. Those aren't necessarily my lane, But I'm the sun, so maybe sometimes I'm gonna have to orbit myself. I've even told I'm gonna have to work on housing. Who knew about that? But those are the things that we do. I want to bring your attention to, we have these cards if you're really interested in them, that the Health Equity Equal Black Unity emoji cards. This is for our healthcare campaign if you're interested in having them. And you may not can see all the fine print, but let me just bring out to you accountability, liability, repercussions, and having the right perspective. That's what's important for us. That is what we're going to be looking at. Not just saying the word accountability or the word liability, but there's got to be some repercussions when people don't do right and you know they're supposed to. When it doesn't measure up and you have something that you need to be accountable for, there should be some liability, some repercussions, and of course, always having the right perspective. These are the things that we fall into place with when we talk about the National Black Agenda Consortium. We are looking at some things that we're considering broad topics. One of those topics are, of course, what are we doing when it comes to population health? We're looking at veterans, we're looking at women, and more importantly, we're looking at people who are formerly incarcerated or returning residents. I hear you. I know you're not a citizen all the way, but we're going to work on that too. Then we talk about specific health ailments, obviously HIV, but then there's things like the cancers, all of them, heart disease, and of course, we're looking at signs and symptoms of substance use and abuse, and we definitely want to make sure we deal with mental health issues. Those are some of the big salient topics. I know everybody wants to look at health insurance, but we're looking at global health. We're looking at distribution of information, definitely getting data out, outcome and outcome measure discussions. So these are some of the things. And of course, one of my favorite is healthcare careers, because I want to make some more epidemiologists just like me. I appreciate you taking the time to look at this particular episode. We only are on once a month, but it's very important to me that these types of discussions will happen in our particular community. I will be out and about going to another event that's going to be at the Arts AIDS in America, where a young lady has been born with HIV. She was born with it. Unfortunately, her mother passed when she was 14, but she was born with HIV. There's going to be a new group of them. There is already a cohort of people who were born with HIV for the last 36 years. They're grown now. What are we telling them? What are we doing to connect with them? So again, I want to thank you all for turning into this particular episode. You are with Tacts, the Association of Clinical Trial Services, where we bring science to the people. I want to definitely make sure that you, if you want to get the fact sheet, that you either hit me up on Facebook, Tacts, or you hit me at, as you can see here, it says Tacts4us@gmail.com. 312-961-6189. I'm your girl, Sister Ya, the community epidemiologist. And earlier you were able to see Mr. Charles Patton, as he said, he is the PC, the People's Counselor. So we want to make sure that we are bringing the science to you. Any type of insight that you need around infectious disease or health equity, which is where we're moving more into, let me know. Hit me up and I will do what I can to work with you. We've got several events coming down the pike, and I really want you to be involved with what it is that Tacts is doing, and that is bringing science to the people. Thank you so much, everyone, and I hope to see you soon.